This week on Healthy Living, we look at how the workplace affects our mental health. Researchers in Toronto shed a light on the mental well-being of journalists. And the WHO has certified Benin and Mali free of trachoma. Plus, a street photographer in Nigeria finds healing in some salsa moves. These stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Welcome to Healthy Living. Do you feel anxious when thinking about work? Does your occupation involve a high level of stress or emotional pressure? If yes, you are not alone. The WHO says globally an estimated 12 billion working days are lost every year to depression and anxiety. The World Health Organization says psychosocial risks or the risk to work-related mental health may be due to issues such as the nature and characteristics of the job, work schedule, or opportunities for career development. Experts say firefighters and soldiers are among workers that can experience high levels of stress and post-traumatic stress disorders. So do journalists. The work of journalists can range from covering crime scenes to conflict zones, among other stories. The University of Toronto is analyzing the risks to work-related mental health. From New York, VOA's Christina Caicedo-Smith has the details.
What impact does a career covering famine, war, disasters, and insurrection have on the journalists covering them? That's the question Anthony Feinstein set out to find. For the past 23 years, the professor in psychiatry at the University of Toronto has amassed a database from surveys of over 1,100 journalists, comparing the results from reporters on the front lines with those who cover less dramatic beats. His study, Predictors of Psychological Distress in Frontline Journalists, finds that female journalists may be affected to a greater extent because they are more vulnerable to violent acts.
And you see more depression in women journalists than men. It's a very consistent finding across whatever country we've looked at. In multiple countries now, it's something that kind of transcends country, transcends culture. Women journalists are more at risk.
But there are steps that newsrooms can take. Alison Baskerville is an editorial security specialist for Reuters news agency. Her job is to ensure that journalists in conflict zones have the resources they need.
And also as the safety people, we need to understand how much exposure they have to that kind of threat and what it is doing to their mental health.
Post-traumatic stress disorder, or PTSD, was first recognized by the American Psychiatric Association in 1980, but newsrooms worldwide have been slow to recognize how it affects reporters. Hannah Storm is the founder of Headlines Network, an organization that provides newsrooms with mental health support and training. She says recognition of the issue is important.
There's more of a realization in newsrooms that we need to address and acknowledge and normalize conversations around mental health and the impact of our work on us.
Thanks to Feinstein, safety specialists have more than 2 decades of data collected from journalists who have covered a range of stories, from the conflicts in the Balkans and war in Iraq to the 9/11 attacks and drug-related violence in Mexico, among others.
How much impact does your work have on your mental health? What do you think should be done to improve mental health at work? Here are some reactions from Addis Ababa, Ethiopia.
For the past 3 years, we were blocked. It was as if we were locked in a house. And the psychological toll it creates is extreme. As a journalist, you will witness many things. You will see a person die because of hunger, lack of medicine, or children become orphans. You will witness unimaginable things in one lifetime, and that's hard.
Something I still carry inside of me, for example, is the day we were sent to cover the Miakadra massacre. On the street, there were people lying everywhere, and some were between life and death. We had to walk by them, and reporting in the middle of that was difficult. The worst thing is, I had to watch again what was recorded by the cameraman to make it graphically appropriate for our audiences.
I couldn't bear it. Sometimes I used to cry. We don't have much rest, but every time I go to bed, I can't sleep. When I doze off immediately, I start seeing dreams of myself providing medical help. And I always wake up trying to pick someone up. The picture of the victims was printed in my mind. Due to this, I used to have headaches, and I was always on painkillers.
The solution is to work on peace, rebuilding our society, and I called the government to focus on this.
My headache was caused by insomnia. To get out of such kind of stress, you always have to make yourself busy. Yet it might pop up again when you pause, so I talk about it with my husband.
Jacques Chimanuka, project supervisor of AIDS in North Kivu, tells us more about how workers can care for their mental health.
The worker is supposed to respond to several deadlines, sometimes in a very short time, from funding partners, from management. And there is another form of stress that people face daily at work. So that's a problem. Why? Because first, stress is a reaction connected to emotional invasion or the result of external or internal pressure that the worker faces. It means that stress overwhelms all the defense mechanism in the body, and when the defense mechanism is overwhelmed, the body produces secret hormones called stress hormones or adrenaline. It is sugar that is produced by the body to give it more energy. And when the body is used to producing adrenaline every day to respond to stress situation, it exposes you directly to diabetes. The first sign indicating that workers are affected mentally is when they lose the will or the courage to perform their daily activities at the same time effectively. And the human body, when it is supposed to meet several needs every day, physical needs, mental needs, sometimes there's incidents when the person falls and faints, and the cause is not clear at first sight. Whereas the root cause is the accumulation of stress, the accumulation of fatigue, which can lead to workers fainting in front of people like that. There are situations that can happen at any time because we don't control our body. We have to work on the prevention and the mitigation of all these risks. Part of the solution is to allow staff sometimes off and rotate them on a weekly basis. It is a combination approach. The hours of work. If a worker must face many demands alone, it will catch up to him eventually. This is why the employer should establish a system of rotation for the teams.
The World Health Organization for Animal Health, WOA, says the West African country of Togo has reported an outbreak of the highly pathogenic H5N1 bird flu virus on a poultry farm. WOA says, according to a report from Togo authorities, the outbreak near the capital Lomé killed 1,450 of a flock of 1,500 birds, and the remaining birds have been slaughtered. Meanwhile, in May, the World Health Organization certified that the countries of Benin and Mali eliminated trachoma as a public health problem, the fifth and sixth African countries to do so. As VOA's Ken Faraboth reports, while the Carter Center is celebrating the milestone in Mali, its work in eliminating and eradicating trachoma in Ethiopia, Niger, South Sudan, and Sudan continues.
The leading cause of preventable blindness in the world.
The Carter Center was already a decade into its fight against guinea worm globally, when former President Jimmy Carter and his global nonprofit took on another neglected tropical disease in the African nation of Mali. Kelly Callahan is the director of the Carter Center's Trachoma Control Program.
25 to 50% of the children between the ages of 1 and 9 in all areas of Mali suffered from the beginning stages of this disease.
It was a statistic Callahan says troubled Carter.
The Hilton Foundation asked President Carter and the Carter Center, would we be willing to consider working on sanitation and water to combat this disease called trachoma in Mali and Niger?
The Carter Center set a goal of eliminating the disease in both countries.
Her eyes, no trichiasis.
Trachoma can be transmitted through infected discharge from the eyes and nose.
This disease is preventable. A bacterial infection that stems from access or lack of access to water and sanitation, poor living conditions, socioeconomically stressed populations.
Since 1998, the Carter Center and its partners have funded and staffed programs with host nations to develop strategies that both treat and prevent infections, even during Mali's recent armed conflict. The Carter Center believes its program in Mali has helped avert blindness in more than 5 million people, and the antibiotics used to combat trachoma also help prevent infant mortality.
The elimination of trachoma as a public health problem in Mali is no less than Herculean.
Sadi Musa, the Carter Center's senior representative in Mali, believes the success of his organization's trachoma program could boost efforts to combat other neglected tropical diseases like guinea worm.
This also will help us, with donors, to show them that we are serious in what we are doing, and we can convince them to get more resources.
While President Carter has retired from public life and is receiving hospice care at his home in Plains, Georgia, Callahan says they keep him up to date on recent developments in Mali.
And we heard that President Carter was just thrilled beyond belief. So we're very excited that he knows.
Callahan says while Mali's elimination milestone is important, the Carter Center's work in Africa is far from over.
We work in 5 countries, including Mali. Those 5 countries have the worst known trachoma in the world.
The World Health Organization says trachoma remains in 23 African countries, and approximately 105 million people on the continent live in areas at high risk for infection.
Street photographer and dancer Emeka Adendu found solace from his mental health struggles in Salsa. Now he offers free classes in Nigeria's capital, in a country where issues such as depression and anxiety carry a stigma. Angela Okumadu reports.
Emeka Adendu says Salsa saved his life. For the Nigerian street photographer and dancer, it offered solace as he grappled abuse, depression, and suicidal thoughts.
Salsa was the only thing that could make me smile. All those days I was battling, fighting with my demons, with my past, with my everything. Salsa was the only thing that makes me feel like living. The most interesting thing about living on earth was salsa.
Today, Adendu is bringing the healing power of the popular Latin dance to others. He offers free salsa classes in Nigeria's capital, Abuja. They are open to anyone going through trauma or those who just want to unwind and relax.
Because it's a couple dance. And when you dance with someone, there's no space for you to think about your sorrow, because one, you're thinking about the music, you're thinking about the counts, the rhythm.
In culturally conservative Nigeria, mental health issues often carry a stigma. Mental health professionals like Dr. Nancy Ojinta say that stigma can exacerbate the situation, equating mental health struggles with spiritual problems.
It is not a spiritual problem, it is a health problem. People always easily identify physical health. Okay, I have malaria, I have diabetes, hypertension. I think it's normal, but then when it comes to their brain being ill, they start trying to find another way to explain it away instead of knowing that it is one more illness.
According to a 2021 report from UNICEF, 1 in 6 Nigerians aged between 15 and 24 struggle with issues such as depression or anxiety. Adendu says salsa gave him love and happiness when he was most in need. Passing that on to others, he says, can be his gift to the world.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Linor Mudu. Until next time, stay well and strive to make every day a healthy day.